This is about mobility of the cervical vertebra. It's a very important, nice topic. If we know structure of the vertebrae, cervical spine, especially atlanto-occipital joint, atlanto-axial joint, and ligaments of the vertebral column, at the same time cervical vertebra, and stability of the vertebra. If we know all these topics, then only we can understand the mobility of the cervical vertebra. The mobility of cervical vertebra, it is going to give us a nice information how the cervical spine is working. Okay, now we will see. We know already what and all movements are possible in cervical spine. If we take C spine, here will be getting flexion, extension. Flexion, extension movements will be happening sagittal plane, frontal axis, and then lateral flexion. Lateral flexion will happen in the frontal plane and sagittal axis, and rotation movement will happen at the transverse plane and vertical axis. Okay, we know this already, and we'll see what we can see other than this in mobility. So if we take cervical spine, ROM is range of motion is more compared to the lumbar, thoracic, sacral regions compared to other cervical regions. So here, compared to other vertebral regions, here cervical region ROM is more. And one more here, the crazy point, cervical spine will move 600 times per hour. Even though we are active or we are sleeping, whatever, it is going to move almost 600 times per hour. So see how much mobility it is having. In generally, if we take atlanto-occipital joint, here the possible movements are flexion, extension. That's it. So these are the movements will happen at the atlanto-occipital joint. These are the two movements. Other than this, so these are two movements only will happen. Okay, see how I am saying, two movements only will happen. Other than this, here lateral flexion and rotation will happen mild. Okay, a mild ROM of lateral flexion and rotation may or may not. Okay, it may happen here. And if we take atlanto-axial joint, here atlanto-axial joint, we know it is a pivot joint. It is going to provide the rotation movement, purely rotation movement. But here, for how much rotation movement? If we take rotation movement, 100% rotation movement is happening in the cervical spine. So in atlanto-axial joint, it is almost about 45 to 55 degrees, 45 to 55 in this 100%, 45 to 50% of rotation will happen at the atlanto-axial joint. So what it is saying means, not complete 100% of rotation is happening in the atlanto-axial joint, only 45 to 55% rotation will happen at the atlanto-axial joint. Remaining rotation will happen from the C2 to C7 vertebrae. And one more point here, if I am going to divide these two into two parts, so here is atlanto-occipital joint and atlanto-axial joint. So when we are doing flexion movement, suppose I am taking, this is our skull. Okay, simply to understand, this is our occipital bone. In this occipital bone, suppose this is anterior, this is posterior. So this is foramen magnum. So from here spinal cord will come, so this is foramen magnum. In this foramen magnum, see here, this is anterior foramen magnum, this is posterior foramen magnum. So this we can say like anterior foramen magnum ring. Okay, this posterior foramen magnum ring or surface. Okay, now if we take here, which cervical vertebra? C1 atlas will be there, and again down to this C2 cervical vertebra. So in this C2 cervical vertebra will be having dense. So when the person is doing flexion movement, so the anterior foramen magnum will touch to the dense. So because of this contact of two bones, flexion is limited. In the atlanto-occipital joint. Okay, if the patient is doing extension, the ligament which is present here, that ligament, tectorial membrane. Okay, tectorial membrane is going to stop the further extension movement. So this is one special point we should remember about atlanto-axial joint. Okay, so here atlanto-axial joint over, atlanto-occipital joint over, atlanto-axial joint over. Now if we will come to another, see, lateral flexion and rotation movements. Are highest ROM movements in the cervical spine compared to lumbar region and thoracic region. So here, these lateral rotation and lateral flexion and rotation, are why it is more means. So this lateral flexion and rotation is going to happen from between the C2 to C7 cervical vertebrae, mostly between these vertebrae. So here it is because of the facet joints orientation. These RVMs will be more in the cervical spine. Okay, here we have flexion movement, cervical flexion. The cervical flexion, where and all it's happening, if we take atlanto-occipital joint, here flexion is happening. Atlanto-axial joint, here also slight flexion is happening. C2 to means C3 to C7, here also flexion is happening. So in all the cervical spine regions, flexion movement is happening. So where is the maximum? Where is the maximum range of flexion is happening? Means it is between C4 to C6. So C4 to C6 vertebra. So between these C4, C5 and C6, these three vertebrae are going to involve more in the cervical spine flexion. It is a very important and typical point. Okay, so here the more cervical spine flexion will happen. So if the flexion is happening between these three vertebrae, mostly means extension also will be between these three vertebrae more. So here flexion extension will happen more between C4 to C6 vertebrae, C4 to C6 vertebrae, and flexion extension movements will happen less in between C2 to C2 to C3 vertebrae. This is a very important point. Okay, C2 to C3 vertebrae, between these two vertebrae flexion extension range is less, and C4 to C6 flexion extension range is more. Same like this. If we take atlanto-axial joint, here rotation movement will be there. Okay, rotation movement will be there. So the rotation movement which we are seeing in cervical spine, it will happen more in the atlanto-axial joint and less in the C3 to C7 vertebra. So what it means, the rotation movement, it is not only related to atlanto-axial joint, it is related to remaining cervical vertebrae also, but most of the rotation will happen at the atlanto-axial joint. Okay, next point. What all the movements are happening here? Either flexion, extension, lateral flexion and rotation. Finally, all these movements should be controlled by the some structures. If we are not going to control these movements, what will happen? These movements will lead to injury. So which structures will control these movements means those structures are ligaments, muscles and bony prominences. Example here, bony prominences, uncinate process which are going to prevent the further lateral flexion and rotation movement. So ligaments, muscles and bony prominences and facet joints, annulus fibrosus, which is going to helpful in the rotation, and at the same time it is going to prevent the rotation. So all these structures has to help to the movements when the patient is doing movement. So if these structures are not in normal anatomical structure and function, then it is going to lead to the instability of cervical spine. So this is what about movements of the mobility of the cervical spine. So before going to mobility, before going to anywhere in our biomechanics mobility, first we should understand what is stability. After that only we should come to mobility. Okay, mobility. So if we need best mobility means first we need good stability. That's what here the point. These all structures are going to provide stability. If these are not going to provide stability, then it will go for instability. So first we should understand stability, then only mobility. So to understand stability, first we should know what are the structures which are present on that region. Here we took cervical region. So here we should understand what are all the structures we can see here in cervical region. Either atlanto-occipital joint, atlanto-axial joint, C3 to C7 vertebrae and atypical vertebra, that means C1 and C2, and typical vertebra C3 to C7. So what are all the ligaments will be present here, how the facet joints will work here, so what are the orientation of the facet joints. So everything we should understand here in structure, then we can understand stability easily. If you understand stability, then you will understand the mobility. So this is about the mobility of the cervical vertebra. Clear?